I've got all these different factors and I'm fighting for my life, and they're presenting yet another roadblock. It was very upsetting to me.
Our whole role is we work in Medicare compliance for the hospital, so we're very aware of what care is necessary. The plans were supposed to cover whatever Medicare covered. Unfortunately, what we were seeing was a trend where there was very aggressive denials for care, which otherwise we would have been approving. And so we decided to start championing this and start looking into it because we really didn't feel that this was right. And it was clearly a national trend that we were seeing.
I was at a point where I could not walk and do so without hurting myself or someone else. It was deemed that it would be best that I enter an acute rehabilitation program. But I was denied, I was frightened, I was confused, I was very ill, and my doctors diligently hammered them, and we worked out an action plan.
If the appeal process hadn't been taken care of, he would have gone either to a subacute rehab facility, which is a lower level of care, or he could have gone home where his wife was there and she couldn't physically take care of him.
We encountered much of the frustrations that patients were encountering. And so you would get on the phone with the plans, and the plans would start quoting rules about their coverage criteria. Nobody really understood necessarily where these rules are coming from.
So they were able to go back with hard facts and represent, and as a result, there's almost irrefutable evidence that they saw that I was in desperate need of an acute rehab facility.
The rules are actually not bad, it's just the way that those rules are being applied by Medicare Advantage plans and programs was inconsistent and oftentimes incorrect. And so we were able to find a way to advocate for our patients.
For any individual who is hospitalized, it is overwhelming to try to figure out what the resources are available to you so that you can get all the care that you need. So it's extremely important to have someone who can support you when you're going through this process with the insurance company so they understand why you need the rehabilitation services and we can work to get that approval so it takes the burden off of you as the patient.
Denials are absolutely not the end.
It was a human being on every one of these cases needed this care. There isn't an easy reference. However, what I did is I went in and I read the regs that protect patients. And also I started to read the denial letters. We figured out how to make that plan, look at it again, and get them overturned while the patient was still in the hospital and protect their hospital benefits.
It's beyond belief. Everyone was very determined to help me to extents that most people don't imagine.
By doing the right thing for patients, we're making sure they get the access to the care they require.
Rehab is just the tip of the iceberg. There's multiple different service lines that this could be applied to.
I think it's a call to action to everybody to let them know you can figure this out. But you need somebody to really try and to put in the time and work together with all of your teams to be able to advocate on behalf of your patients. This is a system that we can put together, we can work within the regs, and we can get to be able to push back to make sure that patients get the care they deserve.
You know, getting on with my life is great, and having this to get back into that function is just beyond my gratitude. It's just wonderful.